everybody. It's great to be here. This is our third day, and this is the first of two sessions, this one on Telecares, technology and healthy aging at home. And we have a brilliant lineup for you, and I'll hand over to Ian shortly to introduce you. Ian McBeath, who's our chair for the morning, and delighted that he could join us. Could I also thank Tunstall for sponsoring this event? What you won't know is that we've had over 3,000 sign-ups for all our sessions over the course of the week, and over 450 alone for this particular session, which makes it a record for the LIN. And while not everybody has joined us so far, most of you now will be live streaming, but we know at least 3 times that number will watch again when they download the recording and watch the PowerPoints that Sally was just referring to. The sessions and the summit itself would not be made possible without the generous support of our sponsors. For this session, as I said, Tunstall Healthcare. Thanks very much, Angus and the team, for your support. But we're also grateful for our wider sponsors who sponsored other sessions and the conference as a whole. And the next slide will show you the list of those sponsors. They include Guinness Partnership, Tunstall, as I've mentioned, UKRI and Level Later Living, and our associate sponsors, Extra Care Charitable Trust, Faithful and Gould, Housing 21, Invisible Creations, Johnny Johnson Housing, ProCare Limited, PRP, and Shakespeare Martineau. Big thanks to all of you for your continued support. Well, that's enough from me, and I'm going to pass over to Ian McBeath. He's the Strategic Director of Health and Wellbeing at Bradford MDC. He's a great friend of the LIN, and it's such a pleasure for him, I hope as well, but for me, for him to be with us. So, Ian, over to you.
That's kind. Thanks very much, Jeremy, and welcome everyone. Thanks for joining this session this morning at Telecares, Technology and Healthy Aging at Home. So as Jeremy said, my day job is I'm Strategic Director of Adult Care for Bradford Council. I'm also Director of Integration for Bradford District Care Trust. So I'm trying to get the NHS in Bradford more interested in telecare and telehealth, and put some of their investment their way. Perhaps a little bit more of that later. Now we are tweeting this morning, so if you want to tweet about this event, then you can either mention HLIN comms with that at the start, or use hashtag HLIN Summit 23. There's been a lot of activity on Twitter, lots of people joining these sessions, so we'll get some enthusiasm around that, I hope. We've got 4 brilliant speakers for you this morning. We've got to start with a bit of a double act with Jonathan and Angus. Then we've got Paul Akinwala, Deputy Director for National Healthcare Equalities Improvement Programme at NHS England, so very much get a health view. And then my longtime friend Alison Scurfield, who's the Chief Exec at the Tech Services Association. So some great speakers. And then towards the end, there'll be a panel discussion. So I would encourage you to use the Q&A button at the bottom of your Zoom screen. And while speakers are speaking and a question comes to mind, then hit the button, put a question in there, and we can use the last minutes of our time together to try and answer as many of those questions as possible. So hope this will be a really great session. I'm going to hand over now to Jonathan and Angus to introduce themselves and give us a great presentation from a Tunstall and the County Council's network point of view about a recently published CCN report. So Jonathan, Angus, over to you.
Thanks very much indeed, Ian. And Angus hopefully will be sharing our slides pretty shortly. Yeah, here we go. So it's a real delight to be here today and to speak to another audience. We published this new report, Adopting the Right Technology to Support Adult Social Care, about 3 or 4 weeks ago, but it's been a project that's been in the works for some time. Some of you may be aware that Tunstall and CCN first came together to actually work on this particular area about 18 months to 2 years ago. And we were well aware of the fact that technology is a really vital part of making sure that social care works, something that the County Council's network is sort of increasingly aware of because of the demographics within our local authorities. We do have ageing populations. We are aware that with funding that's available for social care at the moment, we are under pressure, and looking down the line, those pressures are only going to grow. And so we need to look at how we can use technology really smartly. And Tunstall obviously share some of our concerns, but also have some of the expertise that we don't necessarily have in a small organisation. So it made sense for us to team up and to actually pool our knowledge of both how the social care system operates and the technology that's available to actually come together to write a report called Employing Assistive Technology in Adult Social Care. And this was based on a roundtable that the two of us held together with CCM members and other experts to actually discuss these issues. So you could see employing assistive technology in adult social care as the why this is such an important issue, and it was published ahead of the government putting out the People at the Heart of Care white paper, and we were delighted obviously when that came out that this was given a central position in the strategy, even if it's not quite as front and centre as we would want. So what we kind of did after that is we regrouped and we thought about, well, what's the next step with this? And actually you could see our new report as the how. And so we were particularly keen to make sure that with 150 million investment on the table for local authorities and potentially more, available above that for the housing sector, what would be the right technology and how should this be done? And so we've got together again and put together this think paper that just starts to actually unpick that at a high level for strategic directors in local authorities and members of councils to actually think about these issues. The next slide, please, Angus. So we've grouped this report into three specific areas. The first one, which I'll talk about, is about enabling the right system and solutions in local authorities themselves. The second, which is probably the most pertinent to this audience, is about delivering the quality care to citizens, and that's a bit more about what should actually be going directly for citizens and being used in the homes. And then the third part, which is particularly important for local authorities, is for them to actually be fully aware and understand of the current transition that's going on from analogue to digital provision of communications, to make sure that the risks that are inherent in that for social care devices are fully understood by local authorities and that they are making the right preparations to ensure that that transition is nice and smooth. So as I say, I'll just cover the first section about enabling the right system of local authorities, and I think we were really clear in terms of making sure that we group these into these two separate areas to actually think about. There is the stuff that actually goes in directly with citizens that can actually support them and the help that's required, but there's also the back end and the stuff that goes on behind the scenes that local authorities need to do to make sure that their systems work correctly. Now, obviously, over the last few decades, local authorities are embracing this technology more and more. But it's time to actually really think about how this can all be properly integrated and really start simplifying the system now that we have such a sort of incredibly effective assistive technology and the projections of how dynamic it's going to be in the future. One of the key things is that we want local authorities to think about how they can simplify access to social care. That involves actually, obviously, sort of from 20 years ago, an awful lot more of registering online, but it's going to be increasingly important for local authorities to do some of this processing using electronic and digital means, simply because of the weight of the number of assessments and access requests that we're going to get. Those of you who will be well aware of People at the Heart of Care will recognise that the system, when it actually does come forward in 2025, we're expecting at the moment, will generate a huge amount of new assessment requests in order to actually register towards the cap on social care costs. And we did some research at the County Councils Network last year that estimated that that's going to generate, just in its first year, about 200,000 more assessments. Now, that's all going to require an awful lot of manpower in local authorities that we're obviously underway in terms of trying to recruit, but we need to actually support that investment with actually making sure that the systems are in place to process those additional requests in the most effective way. There are obviously lots of implications about data. We need to be actually thinking about data protection and about all of the GDPR issues, but also thinking about how data can be used in a positive way. And I'm sure that many people will be aware of the increased predictive technologies that are available, and something that can be really important within the social care world. If we can actually just identify those residents who might be most at risk of a fall in their home, etc., which we know can be that cliff edge leading people to poor outcomes in the future, then we can actually do far more to actually anticipate that, to try and prevent that. And so there is this idea of using technology as a predictive tool to enable preventative support, as we've put there. Obviously, there is a massive incentive for the sector to actually embrace this, simply because it can actually maximise the workforce efficiency. And I think it's a sad but realistic fact that at the moment we do not appear to be grasping the nettle of actually funding the workforce properly. The People at the Heart of Care white paper does make a lot of really positive moves in terms of actually career development and improving the status of the workforce, all of which is welcome. But I think that particularly when we're finding we're in a cost of living crisis and rampant inflation that is raising wages within many of the competing sectors, which I'm sure you'll be well aware of in this audience, then there is an issue where we're going to need to start addressing pay conditions. But even if we do that, it's highly likely that if we replace that 10% of the workforce that we know is currently a shortfall, there would still be a huge amount of demand on the staff with the amount of demand in the sector we're expecting going forward. So we need to look at how technology can maximise that workforce efficiency. There's also better integrated services that are really important. Ian alluded to working to try and get health more involved. We do actually have the vehicles to actually help us to do that better now with the integrated care system model coming forward. It shows an awful lot of promise, and local authorities are particularly keen to hope that what we can do is to start thinking about how we can better pool our money and ensure that NHS systems are actually working well together. There's a need to actually simplify messages around technology. The report does, indicate the importance of making sure that language we use on websites, etc., is understandable and to people, particularly recognising the fact that there is still a number of digital inclusion issues that have been particularly highlighted during the pandemic. But I'm going to hand over to Angus now to talk also a little bit about the cultural change that this is going to require and the different ways of working. So Angus, I'll hand over to you to talk a bit about our SMART acronym.
Thanks very much, John, and good morning, everybody. My name's Angus Honeysett. I'm Head of Market Access at Tunstall Healthcare. And those of you that know me will know that culture change is something that's high on my agenda and something I think is really important. But technology has historically been seen as a barrier, and I believe that cultural change is required, which in turn needs early engagement. We need to lead from the top to ensure stakeholders have input at an early stage into how technology can help them and the citizens they support. But there's still a fear that needs to be addressed. Stakeholders need to know technology is an enabler to help them, not replace them. And users need to feel assured that tech is there to enrich their lives and enhance well-being and happiness. But culture change also applies to citizens, and even understanding how to access housing or care services is often unknown. And when needed, people, and that is carers, family members, or close friends, are often at crisis point and will attempt to access any service that will listen to them, even if it's not appropriate. So even if citizens understand how to navigate the system, it can still be difficult. We need to simplify things by having easy access services, efficient referral processes, and solutions for citizens to get the support they need quickly and easy. And too often citizens need help right now, but don't even understand how to access the support they need in the first place. And when they get past that barrier, it takes time, and often time the citizen doesn't have to allocate workers, create care plans, and agree what's needed. So in the report, we talk about culture change being outcomes led. And whilst as a nation we're improving, we've still got a long way to go. Indeed, defining outcomes, that is what we want to achieve, is difficult, can take a long time due to many stakeholders being involved. But one of the things that we wanted to put out and have put out in a sort of a rework of the SMART principle. which hopefully you can now see on screen, where S stands for simple, which is defining outcomes that are simple and easy to understand for yourselves, for your staff, for citizens. They're meaningful. And what we the emphasis of that is making sure the workforce understands what's expected of them and that they're fully engaged. The A stands for agreed, which is working collaboratively with the workforce, seeking agreement to embed outcomes and cultural change. Because if they're agreed with the workforce, they are going to be far more keen to put cultural change into practice. R stands for review, and what we're sort of focused on there is including system review and continuous improvement as part of the service design. So if that is part of the design at the beginning of the process, then it's very easy to review and go back to what outcomes we define at the beginning, all the way through the process to did we actually achieve those outcomes at the end. And then T stands for test and retest. And perhaps a bit bold, but don't be frightened to change if things don't work. So what we often see is things get put in place, processes get put in place, and we don't revisit them, don't change them if they don't work. And the sort of the message that we're putting out there, fail fast and fail quickly, because if we can do that, then you can say, well, you know, that didn't quite work. It was a good idea, it didn't quite work for me, but actually let's go back to the drawing board and think about why didn't it work, but what can we do better to improve a process, to improve access to systems and solutions for citizens more quickly. So that's sort of an overview of the sort of the first section of the report, enabling the right systems and solutions in local authorities in particular. And I think that can also apply to housing associations and the health sector as well. The second sort of area that we focused on is delivering quality care to citizens. And the first bullet there, keeping people at home for longer, is a key thing for local authorities, for housing associations as well. And keeping those people away from frontline services is absolutely the goal for those stakeholders and citizens alike, because they don't want to be accessing services, just as we don't necessarily want them in those services. And if that's the case, and it comes back to sort of the preventative piece, the citizens got a better quality of life, and then housing associations, local authorities are able to maximise the financial and resourcing benefits of keeping people at home for longer. To support that, technology is very much an enabler and driver of preventative support, so preventing access to the system. However, I do think that there is currently too much need for short-term firefighting, which sort of almost prevents sort of getting into that key focus on prevention and preventative services. And we need to get over that, and we need to get over that quickly. So that leads into sort of improved outcomes due to early intervention. So the more we can get to people early and support them in their journey early through the health, housing and social care system, the less they're going to access that. You're going to keep people at home for longer, so there's no need for that churn in housing and so on. So as John said earlier on, it's about organisations working together better, and that will then also give them quicker access to care when needed. So what we just put on the right hand side there, sort of things to focus on: effective commissioning, and things that we talk about there is when commissioning, keeping things simple, understandable, and bringing things together. We talk about interoperability, and interoperability is often used in the technology space, but it's not just about tech, it's about services, supporting people at the right time when they need it across with a system-wide approach. Maximizing staff time and productivity falls into that, and then additional support for staff and citizens as a direct result. And we've put some case studies in the report, drawing out some sort of key things that some authorities have done, which may sort of support the work that you are doing. So then the third section of the report is ensuring the right devices work in citizens' home, and with a key focus on the impact of the move to digital solutions. And everybody I would expect would be aware of the transition to from analog to digital solutions and the challenges this presents. And we understand that, and the people on the call are working closely together to help drive that. But it's not just about technology in social care world. We need to be aware of the analog to digital transition is not just telecare, not just telehealth, not just housing, not just local authorities, but it applies to schools, highways, hospitals, and other things as well. So there's a real importance to understand that. So technology is only as good as the infrastructure that delivers it. As the services and exchanges are getting upgraded, we need to be aware of what is happening and when. As a direct result as well, broadband coverage should improve, although we recognise that in rural and county areas there are likely to be black spots. But as a direct result of the move to digital solutions, we should see broadband coverage improve and also digital inequality decrease. And of course, digital solutions can support staff, especially in rural areas. And there was a quote in the People at the Heart of Care white paper that said, digital technologies can support cost-efficient and higher quality social care and housing provision, as well as a reduced cost burden for councils both now and in the future. So again, that key move to support a reduction in cost to local authorities and the system. And then digital technology enables better collection of data and can improve decision making. And that sort of drives population-led health and social care support, which has a direct impact on housing. So again, on the right-hand side, the areas to focus on under analog digital enhanced services, brilliant. The invest to save model of if you invest well in digital solutions, then in the long run, you will save money. Albeit there are limited mainstream digital solutions available, and there are more coming online all the time. But there's just a sort of a warning there. But housing providers should sort of find out the timings of upgrades in their areas, make sure you are on top of what is happening and when. Write an upgrade plan and plan. And I can't sort of emphasize that enough, because if you plan something, you work with your suppliers to understand what that looks like, then you're going to be in a better place in the move to those digital solutions. But understand the risks of what that looks like, and then communicate what's happening to users. And I don't know about you, but nobody has actually communicated with me from a communication provider as to what's happening. I'm expecting it. I don't know when it's coming. And if that's happening to me, and I work in technology world, when you've got an older person or somebody in one of your homes, they also may not know what's happening or what is coming. So it might be worthwhile sort of communicating that to them. So the next section of our report focuses on funding investment, which John sort of highlighted briefly earlier on. And in the People at the Heart of Care white paper, specifically thinking about local authorities, the government sort of highlighted £150 million over 3 years to be accessed via the ICSs, particularly for local authorities, so £50 million per year. Now, when we looked into this and dug into it a bit further, what we identified was that the money's gone to the ICSs, and quite a lot of local authorities didn't actually know that the money was available or how to access it. So with that in mind, when you look at that sort of investment for housing, and they talk about it again in the People at the Heart of Care white paper, there were 4 key sort of goals, if you like. So critical role for ICPs, integrated care partnerships, in driving necessary integration of housing within health and care. Enabling all areas to agree a plan and embedding housing in broader health and care strategies. Boosting the supply of supported housing and driving how services live alongside housing where possible, and increasing local expenditure on services for those in supported housing. And you think, well, that's brilliant, but that's almost the why. What's the how behind it? Well, part of the how is the money that they that has been sort of suggested will be spent over that. So 300 million over 3 years to connect housing with health and care and drive stock of new supported housing, and then investing in the care and support specialised housing with 210 million available from 22 to 25. So the key message I want to put out there is, when we looked at the investment in technology at local authorities didn't know about the money in many cases, or how to access it. So my message there is, there's a lot of money that is available, so make sure that you know how to access those funds and can make sort of applications for them to invest in the services that you are delivering. So then the fourth part of the report is about embedding change in practice. And we start there with, don't underestimate the time it takes to embed change. Now, you could argue that I'm telling you something you already know, but time and time again, we hear of organizations that come along and say, well, we're going to do this and we're going to do it tomorrow. Well, that might be 6 months, it might be a year, it might be 2 years, it might be longer. So please don't underestimate that. Secondly, technology suppliers, housing providers, local authorities need to collaborate and co-create effectively. And we need to do this more and more. It needs good design, looking at outcomes, understanding what you want to achieve, defining things well, and keeping procurement simple. Thirdly, that technology needs to be at the front of center of any strategy for change. And technology going forward is likely to provide the best route over time to enhancing capacity whilst reducing cost and pressure on the workforce. Fourthly, co-design excellent outcomes-based solutions and invest the right time and money in a way that maximizes cost effectiveness. On the right-hand side, consult with citizens and carers about what they need, because often we will design services and solutions that we understand because we work in the technology world, but citizens will come along and say, well, don't really need that, don't want that. So work with the citizens and carers to understand what they want to support them living at home. But then also, sort of, don't panic. I've just talked about sort of the analog to digital move. Plan, develop and implement effective strategies and solutions, but take the time to do that and do that well. And then lastly, communicate clearly to make sure that your staff, that your stakeholders, and most importantly, your citizens understands what's happening and when change is likely to have an impact on them. So then lastly, a lot of what we have in the report is aligned with the TAPPI principles. And I've just sort of put those up on screen, and I know that Alison, you're going to pick up on those a bit later. But we talk about things being co-produced, working together with stakeholders to make sure that happens. Cost effective, because when you're looking at using technology, solutions become more cost effective and more doable, if you like. Inclusive, so making sure that people who are involved understand what that means, and that could be through decreasing digital inequality, active involvement at home, local community, other networks. Outcome focused. I've talked a lot about being outcome focused, and that sort of links into being person centered as well, so that we're focusing on the citizens at all times in what we're doing. And preventative, quality focused, and adaptable. I think adaptable is a really good point, in that, again, it comes back to the test and retest, fail fast and fail quickly, because actually, if we're rigid in what we do, we're not going to be adaptable, we're not going to be agile and able to change. So I think that's a really important point, is that let's sort of put that rhetoric on the table and be able to change as we need it or need to. So that's all from me, Ian. Back over to you.
That's brilliant. Thanks ever so much, Angus, and thanks, Jonathan, for that presentation. I noticed in the chat there's a link to the report that people can access. So thank you both very much. The questions are coming through thick and fast. Keep them coming, and we'll get to those at the end. The temptation to start answering them now is almost irresistible, but I'm going to move on to Bola, who's joined us this morning from the National Healthcare Inequalities Improvement Programme at NHS England, so very much a health view. And I'm told, Bolly, you're going to consider how technology solutions and better integrated services can help improve people's outcomes and reduce the needs for crisis and hospital admission and care home placement. So I'll be really interested to hear your views. So over to you.
Thank you so much, Ian. So yes, I'm Bola Akinwale. I'm Deputy Director for Healthcare Inequalities Policy at NHS England. And part of my remit is thinking about issues of digital inclusion. So we know that for this transformation to happen, for us to continue to use technology across sectors, we need to make sure that people are digitally literate and are able to use those technologies and that they buy into them. And so what we've been thinking about is what is our method, what is our whole system approach to driving up digital inclusion so that we get the outcomes that we're all seeking. And so I'm going to speak a bit about that today. So in the Healthcare Inequalities team, our vision is to achieve exceptional quality healthcare for all through equitable access, excellent experience and optimal outcomes. And so, of course, digital technologies provide tremendous opportunities to open up access to services in ways which we can't otherwise do, to improve experience. If we get the technology right, it can be transformational and therefore a really important method in improving outcomes. And so we think that thinking about the opportunities around digital technologies is absolutely crucial for our work in trying to address healthcare inequalities. So I wanted to touch a bit on some relevant context, because I think there's in some ways the big strategies that the government has published around digital, the recent plan for digital health and social care, for example, which are really important. But I think there are some other contextual things to point to. So of course we know that digital technologies are changing the ways in which healthcare is delivered. And this is a kind of a rapid kind of disruptive change, which isn't slowing down, it's accelerating, if anything. And so telehealth, virtual wards, hospital at home services, they all provide great opportunities for delivering care in different ways. But really, inclusivity in these approaches, both among patients and among staff, our NHS staff, our care staff, is really important to really fully realise the benefits of digital technologies. And so that requires clear partnership working across sectors, including the housing sectors, to make sure that everyone understands and can realise these benefits. And so the pandemic, as we all know, it speeded up the pace of this change, and it necessitated wider adoption of care at home approaches. And you will all be aware, I'm sure, of the work around kind of pulse oximetry at home, the increasing use of different models of care at home, which are tremendously important. And most recently, the government's urgent emergency care plan has set out a vision for patients to have more access to the right care in the right place, in a more timely way, kind of being more person-centred, and ensuring that we do personalised care closer to home or at home. And so this calls essentially for more integrated services, recognising that new digital technologies provide the opportunity to change the ways in which services are provided and to change access, as I've been talking about. The law has changed recently. So the Health and Care Act 2022 introduced new duties on health inequalities, which I go about talking about and trying to kind of make sure that we use to best effect. But there are some important changes around the importance of promoting integration, where this would help to reduce inequalities in access to services or outcomes achieved. And this is a really important lever for partnership working in ICSs to make sure that ICSs are really thinking about those opportunities which can reduce inequalities among the population. And when we talk about inequalities in this legal context, we're talking about inequalities between any groups of people. So that could be based on age, it could be based on social deprivation, it could be based on geography, the places where people live. So it's a really important lever, I think, for the partnership conversations about the ways in which we're going to use digital technology and who benefits from them. And then additionally, there's of course a duty to promote integration So I think that more generally, I think there's a kind of parallel set of powers in the Health and Care Act and powers on local authorities, which I think call us to join up services. ICSs have, of course, been on a statutory footing since July, and they have to publish their strategies. And so this is a great opportunity to consider ways of joining up health and social care with wider services, including housing services. And we shouldn't forget or neglect the conversation about the role of digital technologies in that to achieve better outcomes. So moving on, we are working on developing a new framework for action on digital inclusion because, as I've said, we recognise that to fully realise those benefits of new technologies, we've got to make sure that they're inclusive. And what we want to do is support ongoing learning and action across the system, so provide a real facilitative framework which helps people to maximise the contributions of these new solutions to reducing inequalities, but also mitigates the risks that these new technologies can exacerbate inequalities. And I think that that's a real fear, that there can be, for many reasons, challenges about the adoption of new technologies, sometimes due to funding, sometimes due to people's capabilities, which are determined by other factors. And so we really need to think about how do we unblock those issues. So our new framework is intended to kind of set a vision for digital inclusion, reflecting on both the opportunities and the risks, acknowledging that we've come quite a long way over the pandemic. Set out the kind of areas for practical action now at all levels of the system, and the critical need for partnership working, and set out what we in NHS England want to do over the long term to focus on specific strategic issues that we've identified through our engagement, because we know that there are some strategic blockers to understanding how to best implement all of our new technologies in the most inclusive way. And so I think there's a really important thing to think about where we have to acknowledge both the opportunity and the risk. And I think this speaks to some of the points that were made in the earlier conversation. We know that where we use digital technologies at their best, we've got a really important opportunity to help reduce health inequalities, because we ease access, we can use different modes of support, we can enable personalisation and self-care at home, we empower people to report information and we get better data, and that all supports more sophisticated population health management. It enables us to target capacity where it's needed and therefore helps us to reduce inequality. So at their best, these digital technologies are a phenomenal transformational asset. But at their worst, there's a risk that we exclude people, that we don't make them use of the facility to collect new data, and we conceal need rather than revealing it, that we constrain interactions. I'm sure some of you will have had moments where perhaps you've tried to use technologies and it's difficult, it's hard because it's not designed in the right way, and that's really difficult for delivering the best care that we need. So we've got to get that right. But also where there's just a single mode and we're fixed and inflexible in the ways in which we design services, we know that creates problems and can be really exclusionary. So overall, if we get it wrong, there's a risk of overlooking needs, of poorer quality support, of late intervention, of inappropriate diversion to urgent and emergency care services, and ultimately of exacerbating health inequalities, which is the thing that I am most passionate about. So what we want to do in our framework is set out the things that can be done at all levels of the NHS and in partnerships with other sectors, including people working in housing, to ensure that we have the fundamental levels of digital literacy that are needed to ensure that we can start to adopt all of these different technologies in the best way that supports reductions in health inequalities. And so at core, that means we need to make sure that there's access to devices and data, that in all settings people can access the devices and data they need, and that members of the public, people that need care and healthcare can do that too. We also need to make sure that we design right. So we need to make sure that we've considered accessibility and ease of technology and ease of using these different technologies, as I've said, because otherwise that's going to be really detrimental to achieving the population health outcomes that we're seeking. Crucially, though, and I think this is a recurrent theme, we really need to think about the skills and capabilities among our workforce and among the people that we're caring for and supporting, because this is a major factor in the adoption of some of these technologies. Where we've got technologies which require members of the public to interact with them, we really need to make sure that they're well equipped and that they're comfortable using digital solutions, for example, routinely. And we need to start with where people are. What the literature tells us is that people come on board with using digital solutions where it's easy for them, where they've got the motivation to use it. And linked to that, we really need to think about how we build belief and trust in some of this. So we know that there are often fears about what happens to information, who sees it, whether it's accurate, for example. So there's also a really important piece in helping to understand helping people to understand what happens to the information and the kind of mechanics behind some of these technologies. And I think that's crucial for both staff and for patients, as I've said. Across all of these themes, we have heard so emphatically the importance of coordination and collaboration across systems. I cannot emphasize this enough, and we think that the housing sector has a really important role to play, because you will be meeting people in different circumstances. We all know that there should be a joined up approach where people have kind of no wrong entry into the system, but actually they're met at the point of their need, and kind of we join up care around them. And so therefore the collaboration across the system is really important. But I think what we've recognised is that currently in some of this work around driving up the use of digital technologies, there's a bit of fragmentation, and then there's a need for better coordination of how this is working. We've recently undertaken some research which looked particularly at how to kind of improve the motivation of people to use digital health and care services, and it was informed by a behavioural science approach. And what we found is that for both members of the public and for staff, the factors that affected their motivation to use some of these digital channels, particularly for those who could, had the opportunity to use them, were about the perceived effectiveness. So whether the solution kind of can deliver the outcomes that they're seeking quickly, whether they feel like they're understood, and the channel has an opportunity to kind of have a dialogue and communicate needs, control over the work that they're doing. So whether the solution gives people control over the support that they need, and also confidence, whether people have the belief in their capabilities to use the technology to meet their health and care needs. These are important factors to think about as we start to roll out these technologies. And we also identified, based on this research, on opportunities for change. So I won't go through all of them, but you can see that there's a really important opportunity about making sure that we're thinking about all of the moments where we can start to use digital technologies routinely, and where we talk about the trusted voices, people who are like me, who are also using these technologies, because that can make a real difference. We also need to think about our levels of transparency in terms of how we're describing what these technologies offer, and give people a really clear understanding of what they can expect. And we think that these are really important foundations for getting this wider adoption. Finally, I think it's really important to highlight that digital technologies are always going to be complementary to other service offerings. So at our most sophisticated, we think about how do we design our services to best effect to get the outcomes we want, and what's the role of digital within that. And it means that the technologies will work in some cases and not in others. So having a really sophisticated view about where non-digital means are the best approach is really important too. So just to end, we are thinking about some areas where we can do some more strategic work in this space to help drive up digital inclusion. But I really wanted to kind of highlight two areas. One is around kind of increasing the use and collection of person level information. So we know that that's a tremendous opportunity. And if we're going to realise this vision of doing kind of sophisticated population health management, enabling that join up across systems, we really need to maximise the ways in which we're collecting data with these new technologies, and we shouldn't miss that opportunity. I think the second is just to emphasise this need for coordination, collaboration and communication across systems. You know, in some places there is really important synergist work going on, and we think that with that join up, we can really maximise the impact that we're having around both the adoption of digital technologies, but also making sure that it's inclusive of everyone who needs to benefit from it. So I'm going to end there.
Well, that's brilliant. And I'll have a couple of questions for you, perhaps after the next presentation, just about how we join up this great strategic stuff, which in the NHS can sometimes be separated from the programmes of work like urgent care or and virtual wards. And it's just what advice you've got for us to help connect those up. But I'll come back to that at the end with questions. So thank you very much indeed. Right. Well, our final speaker this morning is Alison Schofield, who's the Chief Exec of the Technology Services Association, talking about TAPPI. Now, TAPPI, I'm trying to think back to the day, Alison, for it was about innovation, wasn't it? It was about the ageing population. Remind us what TAPPI stands for, and I'll hand over to you for your presentation.
Great. Thank you, Ian. Let me know when you can see the presentation.
That's brilliant. That's it. Thank you, Alison. Yeah.
Fantastic. I've got some context setting first before, and thank you, Jonathan, Angus and Bola. You've really positioned the intro to the presentation that I'm going to give today. So Alison Schofield, I'm the Chief Exec of Tech Services Association, but also the standards body for the sector. So outside your regulation, CQC and others across the UK, we are the only UCAS accredited scheme across the UK, which gives us a lot of power to really start looking at the right care, the right place and the right time, but more importantly, unlocking those personalised outcomes that we've all heard about. So we've got to start with, before we go into TAPPI, with the reality of implementation. There's been lots of drivers. So Ian and I do go back a long way. March 2021, when we published our commission report, we both, along with others on the call, Jeremy, sat at the strategic development of the people at the heart of care. And the first few sessions, you know, housing was missing out of there. And as a housing specialist a decade ago, when I came over to this job, housing has to be at the heart of care. Every conversation about care or health should have a conversation and start with housing. You'll see across the whole of the UK, there's integrated policy drivers, and Bola talked about the emergency care plans that are forming at the moment. What was really a key driver and an absolute honour for me in October 2022 was when the NHS mandated tech responders in communities with the badge of the quality in Amanda Pritchard's Going Further for Winter. That tells us there's a shift there in all of the policy direction, turning that policy and strategy into action. And this is where we look at TAPPI. So TAPPI is a technology for age and population, a panel for innovation. Many of you with the housing profession will know about the HAPPI principles, which are embedded at every part of your journey when you're building new housing, retrofitting housing. But the key principles of the first phase was turning key principles, which Angus went through, all of those key principles into reality. And what did that look like? So phase 2 of TAPPI is taking strategy and implementation into true embedding into communities and giving us a platform. The partnership with Dunhill Medical, TSA is a national industry partner, and HousingLIN is quite unique and getting the partnerships together to work. People, partnerships and data is how we affect change in communities. And those 6 test beds across England, Scotland, Wales are the 6 test beds where we're testing the principles for TAPPI. Roy, who's going to be talking, our chair from TAPPI, give us a real, call to action in some of the work that we've been doing, saying gathering evidence and challenging what is perceived to be impossible. He's set us that challenge in terms of what we can deliver, in terms of the framework and the delivery by the end of the project. The goal is to create new scalable housing service models. But as a housing professional on the call today, you go, how do we do that? This framework at the end of the programme, towards September, October time, will give you the tools that you need to truly embed technology in your housing environment. So how are we going to do that? Co-production, you've heard a lot, not just on this call, but it's really important that we co-produce with people with lived experience, but also people with learnt experience, and that is our staff. That is the culture change we heard from Angus earlier on. So we have a co-production partner end to end, looking at co-production at the start, and then looking at our evidence evaluation and benefits. We hear all of the time, where's the evidence? In your board meetings and housing, where's the evidence that we should be doing this in a housing environment? And what's the impact on our integrated care systems across health, housing and social care? And I'm delighted to have Cambridge Centre for Housing and Planning working from the offset within this programme to evaluate the programme, giving you, everyone on the call and across the UK, a real tangible tool to deliver. But what's really key in all of this, and I'm going to talk through some of the practical steps, is workforce vision and leadership. Digital infrastructures, Angus has talked about. We all know about the analog to digital, and all of that work will be embedded into the framework. Tools for our workforce to encourage our workforce to see a completely different outlook on what housing services, frontline housing services should be focusing on. And then standards. This is not just technology interoperability standards, but guidance and standards for our assets on retrofit, our architects who are building before the first brick is laid in a new scheme, the standards that will give you the tools to be able to innovate, but innovate safely. And what's your procurement activity that you need in terms of your purchasing power in a safe and quality way? But the big thing about this programme is the creation of the blueprint. What does a good look like? Hands-on support. So there is programme management in each of those 6 locations across the UK from the team in TSA. So the consultancy and transformational leads are in all of those 6 programmes, driving and putting that extra support, because the main thing we hear from social care and housing is we don't have the headspace. We don't have the headspace to create this environment. The TAPPI principles and the framework will give you a true lever to say, this is what we need to do now, and this is how we do it. So the big how is really important. So delivering partnerships with test beds. There's tenants and staff champions during the co-production. That's well underway. The co-production approach will be shared, so there'll be tools to get you started. What we did see across the 6 test beds, fantastic engagement, fantastic participation with tenants, but it's a layer above that when you truly co-produce with your staff and with your tenants, and it's been quite compelling, the lessons we've learned. Some workforce development approaches, and I'm going to talk through our virtual house and immersive learning. Simple tools and enable services to work through all the steps of embedding technology and wraparound care. We will have lots of case scenarios to share with the solutions and the suppliers and support a better understanding for you, our housing community, to be led by outcomes-led rather than technology-led. What I want to hear on lots in the future is, I'm not a technologist and never have been. What I'm really interested in, why I came to TSA, is that I want to change that frontline delivery, not just in housing, but getting our partners in social care. We have a great opportunity to have a seat at the table at every ICB and integrated boards across the UK. So test beds. So support and outcomes through solutions. There's lots of solutions on here through hydration monitoring, use of smart speakers, testing robotic vacuums. Brilliant. Promoting activity and safe walking with GPS devices, connected care systems, and on goes some of the solutions. It feels like, oh my goodness, what will I choose and what can I choose and what do I procure? This is what this framework will start to give you, the insights of these incredible innovations, but how you embed them within your housing services. So bringing technology to life. The testbed champions, like you see there in Beeld, they've already started the process. That gentleman on the left-hand side there is a technologist. He's Paul Burney from Anthropos. He has a platform of AI and machine learning, but he described to me the process of going through this engagement and this co-production with real people who are going to receive his services was enlightening, and a real ambassador for working with tenants who are going to receive this powerful technology solution enabled by wraparound care, which is incredible. And then building your tech know-how. What we hear is the workforce development. Where are the tools? What are the key levers that we can give our housing? Not just people working in your tech-enabled care service and housing, but what can we arm our repairs engineers, our people that go through the door for the gas checks? How can we do lots of different enablement and culture change across all of our housing services, including mainly as well our housing frontline officers, that housing point of contact with the tenant. So this virtual house is built on tech know-how, and it's immersive learning of understanding an assessment of need, a risk, and then how it can be met by a technology, a person, and wraparound care. It's really powerful, and all 6 test bags will be using this tool to create their new workforce developments techniques by the end of the year. But a big powerful, we've heard about assessment and how that's going to grow. The TAPPI framework will develop assessment tools which will be embedded into the building your tech know-how, giving you practical tools out there to go on that cultural shift. I'm going to finish by the main key thing for the TAPPI development and learning is we brought lots of partners together, and you're going to be able to ask questions of not only Roy Sambach, but Ian was at the forefront of our work within ADAS and a real ambassador for change in social care. So we're launching today, I'll go into the chat, feedback from all the test beds 6 months in. What have you learned? What do you know? What are your challenges so we can work together? But I would really like to encourage 450 registered on this webinar today, really interested from a housing perspective. Please join our community of practice and learning, because if we all do this together, what we will achieve at the end of the TAPPI, September, October time, is a powerful framework and tools to allow you to embed technology into your service offer in housing, but more importantly, making a real big difference for your tenants, frontline services and housing. Thank you.
That's great. Thank you ever so much, Alison. And thanks to all our speakers. We'll move now seamlessly into our Q&A for the last sort of half an hour we've got together. And for the Q&A, we're joined by two other colleagues, Susan Kay, who's the Chief Exec at Dunhill Medical Trust, and Roy Sambach, OBE, the TAPPI chair. And I think what I'll do to start with is I'll ask Susan and Roy perhaps to come in just with their reflections on what they've heard so far. Roy, I was just looking down the questions, and someone's alluding to a brilliant presentation you gave at Oxford University around a national independence strategy. So perhaps you can tell us a little bit more about that, and maybe a little bit about what TAPPI have been thinking about in terms of health inequalities and how we don't inadvertently exclude some people. Can I bring you in first, Roy, and then I'll ask Susan to give her reflections too.
Sure, Ian, and I'm very sensitive to the fact that there are a large number of questions that are likely to come from the audience. So let me just give you a couple of top lines. It's worth you all knowing that my background is a corporate multinational consumer-facing background, and so much of what I'm going to say reflects a bit of that. First of all, I loved the presentations that we've had this morning. Angus's really important focus on getting us to be able to respond quickly when crisis happens is crucial. In my view, the people out there don't really recognize what they need until they really need it. And that is a crisis point. And we innovate well in terms of how we respond in general, but we innovate badly at points of crisis, in my opinion. And that's true, by the way, not just in the context of care and health responses, but in many, many contexts. So I challenge the community that's on the call to think about how to innovate best at points of crisis for ordinary people. There was huge focus on training and knowledge within this multifaceted area of activity, which is care. And it was clear from the TAPPI panel work that there was some uncertainty about where technology was moving, how quickly it was moving, and how it should be applied. So the workforce in the professional context really we do need a coherent plan to ensure that the workforce is trained well. Now, we talk a lot about policy, but in reality, what we want is practice. And the TAPPI principles that were developed, it would be my wish that those principles would be on the desk of every individual who was involved in developing programs and plans for people who are requiring care. And that really this could be a bottom-up movement as much as a top-down policy piece. And if we can get those principles embedded in the housing sector, in the care sector, in the health sector, at the working level, then frankly, I think that we would begin to drive significant change. So that's another challenge for the community that's on the call. I believe, by the way, that we have a market failure. The market failure is in the context of providing for the population at large a message that is, if you don't look after yourself, then you're going to end up in a situation where you need crisis care, crisis support, and can you please work on that? Work on that through a market. And I think there's a messaging, a market, and a mobilization question, which is at the core of what I consider to be a gap in the context of an independent living strategy. And that was my point, Ian, in the Oxford talk that I gave a couple of weeks ago, that we've got that gap and we need to fill it. In that way, we'll help Bola with everything that she's doing in the context of the NHS, because we'll take the pressure off. So thanks, Ian. Thanks, everybody. Fantastic talks. Great test beds for TAPPI. Great perspectives from Angus, from John, and from Bola. I'll hand over to Susan, I think.
Thanks, Roy. I'm here.
Over to you.
Hi, thanks, Roy, and thanks to all the speakers. Roy's absolutely right. It made some great points there. So I'm just going to briefly give you 3 of my reflections, which I suppose really try and synthesize what they've spoken about, throw out a couple of challenges and make one recommendation. So improvement in people's health outcomes by taking a person-centered approach and addressing inequalities is pretty well evidenced, has been for years. When you're in the privileged position that I am of having been funding academic and clinical research for a long time, you know, it's a theme that's been there. It's the systems, the structures, the methods of funding that need to radically change to reflect this. It's now a burning platform. And I think the ICPs are a great opportunity, but we're not really seeing widespread radical change yet. And we shouldn't still be arguing for housing to be included. It's a no-brainer. The other thing I just want to underline, and I think Angus and Bola did this pretty well, it isn't about the technology. It's about person-centered systems, services, products that use tech as a tool that make them accessible and efficient and effective. It's a servant, it's not a master. And then Roy touched on this, and it was something that really struck me listening to the news over the weekend about the announcement about qualifications for people working in social housing. Smart and responsive commissioning are going to be essential, and so changing the skills and the remit of the commissioning bodies and providing training for professionals is going to be really key. And that's something that came up in the TAPPI inquiry sessions, I remember quite clearly, and perhaps something that we need to bring back to the surface. So a couple of challenges. Again, all of our speakers talked about the importance of a person-centered approach, but we need to be really consistent in the language that we use because that drives our behaviours. So when we use phrases like communicate to people what's happening, let's flip that. Let's understand their concerns and respond. Roy and I had a brief conversation recently that went, what is this kind of co-production that we talk about in, you know, the public sector and the third sector? Because actually in the private sector, you wouldn't dream of developing a product or a service without having that really direct interaction with people to try and address and meet their needs. And my second challenge is, to those of you who are tasked in the public sector with coming up with solutions, look to the ground, look at what's happening. There are innovative solutions that are happening out there already. Focus on scaling them up and spreading them rather than reinventing them. It's happening. And then a recommendation that sort of arose, I saw a question, I think it was from Nicole coming up in the Q&A, making the very good point that actually the availability of suitable housing options needs to catch up with the technology solutions that are available. You're absolutely right. And it's why we were keen to support the Commission on the Role of Housing in the Future of Care and Support from the Social Care Institute for Excellence, which has developed a great route map. So please, I urge you to take a look at that along with the TAPPI report and the TAPPI principles, and let's start to make change, because as Alison has just been saying, the tools are there and are being well developed.
Brilliant. Thanks ever so much, Susan, and thank you, Roy. So let's get on to those questions now, last 20 minutes or so. I wouldn't want to forget the people who asked a question about an hour ago, and it's been sitting there. I did see one about charging for telecare from Joanne. I mean, just to remind, I'm sure people on the call know, but councils do have a bit of discretion around charging in this area, and they can either reduce or eliminate the charge, or they could count it as a disability-related expense against people's mainstay care charge. There are all kinds of options there to take during the cost of living crisis. And Mel asked a question right up front about how we fund all this. Now, I do think sometimes we overcomplicate it. We've had joint stores, I know they're not called that anymore, but joint equipment services between the NHS and councils for years. Why can't this tech be part of those stores? It's funny how we could fight among ourselves, the NHS and social care, over 100 grand or 200 grand to get a telecare project up and running. If you pop that in the store's budget, it would be dwarfed and no one would bat an eyelid. So I think there's something just about using the systems and structures we've already got to fund some of this. And I do completely agree with Roy's point about crisis point and waiting until that point to get things started. We almost need some experts right up front when people call us or GPs call us to be assessing and thinking about technology and where people are living right at that first conversation to try to eliminate some of the bad things that can happen afterwards when we don't do that. Let me just bring in some of our panelists again. I'm going to come to Bola first and just ask about some of the things I was alluding to earlier on. So I suppose a bit of a two-part question, really. The first part, Bola, will be the presentation you gave is great. How has that been socialised sort of through ICSs and onto local places, and will it percolate down? And what's your advice for people on the call who might want to influence upwards to make sure that message is being drawn down? And there was a sort of a supplementary, I saw a Q&A presumably from a provider who's saying, well, how can we talk to the NHS about what kind of tech or services that we could assist with? And then just linked to that, there are quite a few questions about NHS funding, and it does feel like with the 2-hour community standard, virtual wards, the agenda about prevention of readmissions, all of this fits together really neatly. Do you think local authorities need to do a bit more of the leading in that area? Would that be helpful? So just hand over to you for your reflections on that, Bola.
Yeah, thank you. I mean, I think that the way in which we've gone about kind of on this digital inclusion piece particularly is speaking to forums of different sectors, across sectors, to be honest with you, and going to where people are, where we're having conversations about technology and the role of digital. It's why I was keen to come and speak with all of you today, because it's another way of kind of socializing the work. So I think we've kind of had a broad conversation with many stakeholders in different places, including, for example, visiting, different digital inclusion forums, digital strategy forums, and so on in different systems. So it's been a kind of 6-month journey of engaging and having conversations in different places, I think is what I would say on that point. So I think in terms of going forward, what we've tried to do with this framework, because I acknowledge the challenges, I suppose, of keeping everything joined up and potential for silo working. I think the way in which we're approaching the work that I've been speaking about is to set a kind of high-level framework for action, a high-level vision and a roadmap, so that really there will be ongoing opportunities for us to have this dialogue. And what we want to be doing, to be honest with you, is in response to the feedback that we hear, be providing kind of practical tools and solutions that really speak to what people need and want. So I think this is a framework which helps us to then move into practice in collaboration with the whole system. I think on the funding point, look, it's tricky. I mean, you've alluded to some of the challenges about how funding sometimes is fought over. There probably is a role for local authorities to play in having more conversation about how this money is used. But I think really there's a conversation to be had at an ICB level to think about actually how our different funding streams brought together most strategically. I think if we're going to kind of live out the vision for what integrated care systems are about and what they do, then there should be more opportunity in that space to resolve some of these funding questions.
Yeah, thanks, Bola. And I've been told in the chat that my camera might not be working. It's funny, Bradford Council laptops don't like Zoom, but if you can't see me, it's probably a blessing. So I'll just continue in the hope you can still hear me. Alice, I was going to just draw you in next. There was a question about what funding is available in Scotland, and I know you do a lot of work with the sort of 4 nations. So I'll just ask you if you can comment on that one, and perhaps say a little bit more about this the holy grail that you alluded to earlier, which is benefits realisation, and the fact that'll be part of the toolkit.
Okay, thank you. Scotland funding, I think it's very similar. So I was up in Holyrood last week presenting, and they were really keen about TAPPI. They've just published their data strategy, a front door for citizens and communities, very powerful. They do have small funding pots in terms of proactive and preventative care in communities, but it's no different to the funding that we're seeing across England and Wales. What we have seen is real strong, powerful funding in Wales, seed funding in Carmarthenshire. And what they've done with that, this was pre-COVID, but pre-COVID, they built a front door from a housing perspective to the front door of social care. Now they're overlaying that with their virtual ward, but they're in Halvar Hospital Trust, the finance director, which is really compelling, leads digitalisation across health, housing and social care. So probably Scotland is good, but if we focus our eyes on Wales, they are actually using the seed funding in a really meaningful way. We always ask where the funding is, whether we're sitting in a social care environment or whether we're sitting in health or housing. What's really incredible is some of the work that we'll be doing with the TAPPI partners is how they best use the housing and benefit. What does that look like in technology enablement? DLG grants, as we know, across the UK are underspent year on year. How do we work more closely with our social care commissioners to make sure that that's widely used? But the business model comes from leadership. And what we have in Scotland is a chief exec at Beeld Housing. She has a health background, worked on Scotland's learning curves, lots of different interventions. What she's doing within Beeld is not only co-producing, she's using her resources more wisely. So how can she enable technology to give better outcomes, make more efficient choices, but have a whole system being more productive? Now, the learning coming out from that is, what can we do more of housing? And the leadership shown from the CEO, and we did make sure that this was there. When we got the 6 test beds, we made sure that there was strong governance from their senior team, because that's where you make the difference. So there's lots of different funding things. It doesn't all have to come from government to be able to achieve this in a housing setting. And I'm hoping that the things that we deliver in TAPPI will give you those levers to do something different with the gift that we already have. So the benefit realisation piece will be across. We have loads of data. We've just heard from Sue that we've tested this. The data's there. There's evaluations being done, but the benefit realisation model in TAPPI will look at what's in it for me from a housing provider's perspective, from an individual in a community, from our health partners. So the ICBs need to see the richness of how you slow down that conveyancing into hospital. There's examples in Warrington where 85% of people have been kept in communities by looking at these tech enablement wraparound services in community. Then how do you get them home? How do we get them home quicker? We're not discharging into care homes. That's the principles at the moment. Now, is that the best place? How do we get them back into communities? Now, so I would challenge us about where's the money coming from. I think we have to own it. Like in housing, we have to work outside into social care and see how they're best using their grants. And we have to challenge our ICBs with their discharge monies about how can we practically deliver that in hospital to home services. So it's not an ideal answer that said it's over there. I think there's a lot of coordination of making sure that we're not just looking to policymakers and government to provide the funding to solve this.
Yeah, I agree with that, Alison. It does feel like we need a number of schemes sort of on the blocks waiting for some of the short-term money to come along, and and take Roy's point about dealing with people at that point of crisis. Well, we need some schemes ready, I think, to launch and pilot at that point. I'm going to bring in Angus and Jonathan. Angus, there are a couple of questions in the Q&A about the digital switchover. Is it more expensive? What's Tunstall's approach to that? And what's Tunstall doing about interoperability and sort of working with other systems? Can you answer any of those for us?
That's a £5 in the tin.
You're the first one. Well done. Well, congratulations.
Before I just touch on those points, Ian, I just wanted to pick up on a couple of things that Alison said about the funding piece. And I think there's an issue around sort of focus at the moment of immediate financial imperative. So the cost of living crisis, the not enough money in the system to fund stuff. And I think that has a direct impact on a lack of focus on the cost of having better preventative services. But I think there's absolutely a desire, certainly a desire from people around the table here, to get those better preventative services. And then you go back to sort of the invest to save model. If you don't invest, then you don't save. So it's a bit of a vicious circle of getting the right thing in place. But then also, Alison talked about evidence and the importance of the evidence and the benefit realization. And I would add into that sort of, once we've got the evidence and looking at the how we need to implement stuff and implement stuff effectively to actually drive change in the system, so to speak. And I often talk about the benefits to, if you get things right for the citizen through preventative, proactive approaches, then the system benefits as a result. I'm still a big advocate of that. We talked about that in our first report. I think is absolutely still valid. Coming on to the couple of questions about digital solutions costing more. Yes, they do. And digital solutions will cost more than analog solutions, but the rich information and data and things that can help to improve decision making as a result off the back of having digital systems in place actually sort of starts helping to save the system money. So, okay, so I've purchased a device, it's cost me more than an analog solution, but what I can now do is I can look at the information that is coming out of that system and saying, well, do you know what, I can focus on that area because I now know what is happening, how and what I can do to change and improve the system in that area, because I've now got more information to help me do that. So yes, it costs a bit more up front, but I think there will be longer term financial benefits as a result. And of course, there's also alternate pricing models that can be applied. Is it a capital purchase? Is it a leasing model over a period of time? There are things that can be done in order to mitigate that upfront cost. In terms of interoperability, I mentioned that briefly. I think it's critically important that not just technology talks to other technology, but systems talk to each other as well. So that's health, that's social care, that's housing. It's difficult. Getting to that point is happening with the ICSs, the ICBs, and the ICPs as well. And I think it's improving. I think there's a long way to go. Just to answer a question around interoperability from Tunstall's perspective, I don't want to dwell on that too much. However, we are about to introduce our Lifeline digital product at iTech, and that will have Senelec, Now IP, Scape is already in our Smart Hub solution. So yeah, we're in that space and very much looking forward to working with colleagues on the call.
Great, reassuring. Thanks, Angus.
I think
you've got your hand up. Is it on this point?
No, I don't know how to put it down.
I was
Yes,
just going to add to what Angus had said, Ian, just by saying, I think that the ICS model is going to be absolutely crucial in this, in terms of actually making sure that we have got interoperability across systems. And as I say, I think that the key challenge is going to actually be making sure that health understand that social care needs to be thought about in a long-term perspective. And the real challenge for ICSs is going to be actually taking that longer-term view of actually investing in the prevention rather than actually being sort of motivated entirely by the short-term concerns. And so local authorities have got a lot of optimism about the potential of ICSs, but I think Bola's absolutely correct that we need to get this onto ICB sort of radar properly, and to get them thinking about it properly, because unfortunately local authorities have less representation on the ICB, which ultimately calls the shots in the ICS. And so I think it's really important that we engage more and more with our NHS colleagues from local government, and that our NHS colleagues engage with us, to actually find out what social care actually needs, to make sure that we are getting systems that talk across each other and that actually have a long-term view rather than just a short-term, let's get through the next couple of months, and deal with winter pressures.
Thanks, Jonathan. Alison, I'll bring you in now.
I know we've only got a couple of minutes, but it's really important. So everyone sitting on the call, you've asked about analog to digital. This is a crisis that we're heading towards for 2025. Analog to digital is about safe, not purchasing like for like, about taking us forward to purchase something that will give us all those opportunities. But if we haven't got analog to digital on a housing risk corporately, that's a mistake, because you have all of your dwellings in sheltered housing. We need to think about it really from a risk perspective. That outage is happening now. So outage of units in sheltered housing, etc., where services are going down, we need to tackle it. So TSA's road buyers guides, we'll have a section within our website where we guide the sector, housing, in a safe way to, one, evaluate your stock, evaluate your technology assets, and how you purchase safely. Happy to get involved in any conversations you need to have. And that isn't coming from one supplier perspective, it's from an agnostic view, which is brilliant. And we work really closely with all of our suppliers, including Tunstall. But ICBs, NHS has already mandated the quality standard framework. They've already said to ICBs that we mandate this as part of universal response. In the QSF, there is a standard for suppliers where we take the standards, the British standards, and everything we need to do about open, transparent communications. If you're purchasing, you purchase with a quality badge to make sure that you're purchasing someone that's demonstrated that they're delivering these services. So there's lots of quick wins for you to purchase safely, and that technology element will come. Interoperability is something we need to write, and the standards in TAPPI will be in your framework so that you can move forward safely, and give you the opportunities to deliver some of those wonderful solutions that you're talking about. So please get in touch. We'll send some stuff out after the call. It's a big risk, but it's a ginormous opportunity if we get this right. Thank you.
Thanks very much. Thanks, Alison. I was just going to ask Jeremy to wrap us up for the last minute or so. It's been a terrific session, but Jeremy, over to you.
Ian, thanks. I couldn't agree with you more. It's been an absolutely fabulous session. Can I thank all the contributors for their pearls of wisdom, really. And I think that while we know that we're not always singing in the same hymn sheet, we have the aspirations to do so. And the purpose of this session really is to bring the housing and the health and social care together and provide the ammunition using the tools that Alison described, the TAPPI principles, to really create that interoperability. But it's not just the interoperability, it's about another I word, creating the independent living opportunities for all residents, not just tenants. I think, Robin, you put a question in the chat box about whether residents and tenants. It is about looking at how we apply this as a citizen-led approach. I wanted to just conclude with a few other sort of small points. Roy mentioned the need and the case for an independent living strategy. If you're interested in that, do join us on Friday when we're joined by DLUC, the Department for Levelling Up and Housing and Communities, where we have a speaker talking about the proposal for an older person's task force. Now, it's not quite independent living strategy, but it might lead to something like that. and picks up again on some of the points that Susan raised around the Commission for Housing with Care that she touched on. You may not know that this is crucially important this week also because tomorrow is the deadline for the planning consultation, how local government will be thinking about how they plan for new build around our housing for all ages, and issues around planning for specialist housing, for age-friendly housing, and making sure that is tech-enabled is critical as well. So do have a look at the DLUC planning portal and the consultation pages. But I want to just end by, again, reiterating my thanks to all of you who've participated, those of you who've signed up to watch and will be watching the recording. Tunstall for sponsoring this session. It's been an excellent event. Ian, thank you very much for chairing it so eloquently. Alison and a couple of others, I think, mentioned an upcoming conference, the iTech conference. Just give that a plug. It's on the 28th and 29th of March in Birmingham. Do look at the TSA website for that. Can I thank the team behind the scenes, although they're now on screen, Jerome and Sally. And for those of you who've been asking for the PowerPoint recordings and the PowerPoints and the recordings, they'll be made available shortly. Please do join us for future sessions. There's one more this afternoon looking at inclusive design, and for the rest of the week, we look forward to sharing more learning and improvement, and perhaps picking up on some of those critical points around workforce development that Sue raised as well in her overview. So thanks again, and have a pleasant afternoon.
Thanks, Jeremy.
Thank you.
Thanks, everyone.
Thank you.
Thank you all.
Brilliant.